My patients were very happy after the breast augmentation. Hi, this is Dr. Roy Kim. I'm going to be talking to you about how I achieve a natural breast augmentation. Now, it may sound a little strange, but one of the things I'm famous for is, yes, breast augmentation, which is plastic surgery, but how do I achieve such a natural look and feel in my patients? One thing which I discovered on my journey as a plastic surgeon with my patients is, my patients were very happy after the breast augmentation for the first month or so. They basically said, look, I love this look, I love the fullness, and I love how natural they are, and I wish that they would always be sort of this elevated and full all the time. I was thinking about this because actually what they were noticing is that they had a lot of swelling sort of at the top or superior pole of the breast, which is very unnatural. What they were really telling me is that they liked the look of cleavage. Yes, they had never had it before, but also I think that a lot of them sort of think that that's natural. After talking to thousands of patients and also thinking about it, this isn't really taught in plastic surgery textbooks or journals or meetings, and I also think that a lot of patients don't really fully admit to what they really want in terms of being natural or not. Now, to me, natural means that if you have beautiful natural breasts, if you're wearing no support, no bra technology, and you are topless, your breasts will separate and drop, and that's normal. You will achieve an overall natural teardrop shape, anatomic shape. That to me is very natural. And of course, I'm a doctor. I've done breast reconstruction, breast cosmetic surgery, purely aesthetic surgery, and this is what I've noticed with my patients. This is what obviously patients notice as well. They may notice other issues such as volume, asymmetry, and so on, but yes, breasts do not touch naturally. That's an unnatural condition that's actually called synmastia. In terms of the drop, that's also normal because breasts don't naturally levitate or stay full. Of course, they may not drop or sag that much when you're younger, if you haven't had children, if you haven't gained 50 pounds and lost 50 pounds, yes, they're gonna be a little more full and stay that way when you're younger with not as many life events or time and age. However, that is actually more natural. So I think what patients really want, and I've confirmed this with lots of patients, and you can tell me if you agree with me or not, patients want to be able to have the ability to have supportive technology, bra technology, where as a choice, as an option, patients can actually wear some type of underwire bra or bra with side panels. They have a low-cut blouse or something that's a little more revealing, and they can actually push up the breast tissue, give some fullness, as well as push them in towards the middle and generate cleavage. And I think even though they may love that look, technically, as we all know, it is not natural. As a plastic surgeon, I want to be able to give you the ability to have that look if you wish, but if you're wearing a turtleneck, if you're wearing something that's not revealing, if you're wearing a regular bra with no underwire, you should have natural looking breasts. They shouldn't be so full that they're always full all the time. Some patients do want to have that fullness all the time. Maybe they just had larger breasts or they grew up having them and they want to retain that rejuvenation. Other patients, it's simply a choice. But to me, to have that fullness all the time, regardless of the type of technology that you're wearing for support, is slightly unnatural or sort of implies that you have larger breasts and you're wearing a lot of support. In other words, to have a more natural look. What you want to have is a really great plastic surgeon as well as really great choices before your operation. In terms of what you as a patient can decide before your operation is this. You want to be very careful about exactly what you want. Do you really want to have artificial cleavage all the time, or do you simply want to have cleavage where it is in more natural proportions to your body, to your shoulders, to your hip ratios, and so on? You want to be very careful about the type of gel, specifically filler material that these breast implants have. Implants today have sort of like a more softer feel, which I think is a little more natural, and a more firm feel. There's nothing wrong with the firm feel, but if you get a larger implant and you get a very firm feeling breast that gives a little more support all the time, that will, just the way of the implant filler material is, give you a little more support all the time. It will give you that cleavage look all the time. And if you want that look, great. But if you don't want that look, then you need to probably pick a softer filler gel. So, as a patient, there are some things that you need to decide to get you the best result that you want in terms of more natural looking breast augmentation. I'll make a separate video on how to have a little more maybe unnatural look, but in terms of a natural look, there are two important things. One, you need to know your general ribcage dimensions. You need to understand that, hey, with no support, your implants will separate a little and will drop down a little. You do not want your implants really, really close. You don't want your overall result with your surgery to be very close. Again, that's called synmastia, S-Y-N-M-A-S-T-I-A, where your breast tissue in the middle here actually touches all the time, and it doesn't matter what bra you're using. That's not a good look, and that's actually unnatural. The second thing that you as a patient need to understand is to pick the filler material. Way back when, there was really only one type of feel. Today, there are a couple different types of feel, where the silicone gel is either put in there in terms of a little more packing, a little more fullness in the actual implant envelope, or there's actually different cross-linking of the filler material gel itself. So those things are important. If you want a more natural feel, my very strong opinion is that you sort of want a more natural feeling or softer gel material, especially when you squeeze that implant. As a plastic surgeon, it is my job to create the perfect pocket for you. So I need to, yes, carefully dissect the pocket for the actual implant, and this is true for breast reconstruction or aesthetic breast. And I want to make sure that the actual pocket fits your specific implant style, the profile, if you will. Those are the things where, if you want a more natural looking breast augmentation, you need to be aware of. I hope this clarifies things because, hey, if you want to have a little more cleavage, a little more artificial look once in a while to all the time, it really depends, yes, on what you're wearing, yes, on supporting technology, but really also on the type of implants, your plastic surgeon, the overall style and look that you want for you. In terms of a natural looking breast augmentation, now I hope you understand that this is not a contradiction in terms and a contradiction in words. Rather, it is possible to get a very natural looking breast augmentation. And if you have any questions about this, please feel free to fire below. Thank you so much for watching.